here and accuse them of being Luddites because they don't want change, they don't want modernisation. Well, that's not true. We do want change, and as has been brought up, if we had a consultant-led A&E in Hammersmith, then it would be a very good A&E, and it should be maintained and kept, then people could use it. But no, we're also being told that this is nothing to do with finance, it's a clinical-led decision. This is not true. We said that there was a consultancy of clinical, there was only about 25 to 30% consultant with clinical consultancy. And the document that is put out said this: our medium-term trust must continue to deliver savings through efficiency measures, delivering further recurrent savings in excess of 207 million over the next 5 years. Well, this is about finance. Why can't we have an A&E maintained in Hammersmith? Why do we have to cut over 300 beds in Charing Cross? These aren't clinical decisions. And this is not going to be accepted. People are not Luddites. They want a better healthcare system and they want better services. Why do we always have to accept, if they can give 47 billion to the Royal Bank of Scotland, when they can put it into the NHS?
That's it.
In her presentation, Tracy Fatton quite rightly said we should move from a hospital bed system to a home care or community-based medical system. I think the majority of people in this room, myself included, would entirely endorse that. But what actually does concern me is that her theoretical model has very little to do with what the UK today, and particularly London, or particularly this part of London, is like. The social care budgets, both for the NHS and for Imperial and the local councils, are being cut so badly there's no possibility of replacing beds with what really are desirable services. And the trouble is, people are getting older. People like myself, or people much older than me, find it much more difficult to travel to the diminishing number of facilities which actually exist. Imagine an elderly person, say myself or older, trying to get to St Mary's in Paddington from around here, I don't live around here, on a Friday or Saturday evening. It's virtually impossible if you have not got a car. Trying to get down to Chelsea Westminster when Chelsea is playing a home match, or QPR, or Fulham, it's impossible. What actually strikes me as a lovely theoretical model is actually not based on actual demographics. And using the word demographics in theory doesn't actually meet what one meets in the street. I'd like to ask Tracy, how would you manage, say, a parent with 2 children having to go to a very distant A&E, pulling a pram on a bus, and then get back afterwards? An older person queuing up for much longer at St Mary's, and then having to come back after treatment. It's a lovely model, but we prefer the actual existing society of Hammersmith and Fulham to be addressed with a plan, rather than the beautiful corporate model. That meets corporation needs, but I think increasingly it does not meet actual person needs.
Will you take a corollary to that? You didn't mention anything of the south of the borough transferring to Hammersmith and Chelsea.
Let's take this question first. It's a very good question.
Sorry, let's answer. Let's get the questions answered. Yeah, very good question.
So I think that was a terrific question, and I think it raises a really important point about the systems that need to be in place within the community, the services that need to be in place within the community to continue to change the way that we deliver care. So we know that services have to continue to change. We understand that, and we know that within the community sector today, there aren't the sort of supports that are needed to support people to keep healthy in their homes. What I think we've demonstrated as we've thought about our changes at the Hammersmith A&E is that we will only put in place changes when we are confident that we have the clinical capacity in the right places to be able to safely and effectively change the way we're delivering care. So what will be required over the next few years is us continuing to work with the community sector, with the social care sector, with our GP colleagues, to ensure that we have the right care available within the community.